Hello, everyone, and welcome back to Talk with Terry Tuesday. And I am Dr. Scott Terry, and I know you're like, who's sitting next to her? So I keep telling you all, we are growing, we are expanding, we are trying to make sure that we are your one-stop shop for everything. So we have our special guest. She is, so I call her MJ.
Yeah.
But MJ, I'm going to let her talk a little bit about what her program is, but she is one of the new fitness trainers that is coming. She's going to be joining Radha. They'll both be in the space. They both have their own separate practices, but they are both excellent. And they're going to get you going, get you right.
That's right.
And then she also has a little extra talent with nutrition.
I do.
So I'm going to let you talk about you and tell all of our listeners what you bring. And we're excited to have her here. So
There you go. I am so excited to be here. Again, my name is Mernia Morris. Everyone calls me Coach MJ. I am a holistic personal trainer and nutritionist. My business name is called Harvest Living Wellness. And so, what we bring is a faith based approach to your full wellness, mind, body, and soul, with weight training, corrective exercises, mobility, stability training as well, and nutrition. And so I'm not one of those coaches that tell you you can't have something. Well, maybe.
so we're all on the same page because I say the same,
Yeah,
but maybe.
but it's in moderation.
Yeah.
And so I get to work with men and women, but mostly women on their journey to wellness, to make sure that they are gaining good muscle, quality muscle. And my time here at Allure Wellness, in conjunction with Radha, is to bring personal training in the afternoons, some evenings, and group fitness classes. And I've been leaking a little bit out there already. And so I have spots open for 15 persons on Saturdays for group fitness, and we're eventually going to have Wednesday night group fitness as well. And I'm just so stinking excited to be here.
We are excited. Like I said, we are trying to be the facility where you are getting all of your health needs.
That's right.
And so fitness, nutrition, that's really key
Mhm.
because if you don't have the right nutrition, everything else is going to be an issue.
Yep.
So we are really, 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 really
I'm
glad
excited to be here.
that she is joining us. So we're excited. You can call us. We'll have her schedule out as well. How do you want them to reach you?
You can reach me by going to my website. It's harvestlivingwellness.com. Sign ups to be the first to know about when the schedule job drops. There is a link on the website for you to do that. I will tell you now, our first class is going to be on August 1st at 8:30 a.m. So you want to make sure that you sign up and click that register me now so that you can be first to know and become a member of Harvest Living Wellness for classes.
Oh, we're excited. So thank you.
You're
Thank you,
welcome.
MJ. I've been talking to her for a little while.
Yeah.
So we are excited that she is joining us. I know everybody wants to know about what is the summer savings, and we have several. We have a vacation summer saving, and we have a summer strength package. So vacation, of course, we've got to get you ready. So that you can get a hydrating, hydrofacial, dermaplaning, SPF, because everybody needs to be wearing sunscreen. Summer, fall, winter, spring, you still need to wear sunscreen. And then we have the summer strength package that has the athletic performance IV, cryotherapy, which helps with inflammation and recovering your muscles, and then our B12 injections as well. So those are just our packages that we have for the summer. But we have our July savings, and so it's going to deal with body, face, and wellness. You can certainly go to our website, you can call us, but it'll include Botox Dysport for different areas for medical wellness. That includes your TMJ, so if you grind your teeth, you can inject for that. If you sweat a lot in your palms and underneath your arms, that will help with that as well. If you have a smile and you see mainly gums. So we have some medical reasons that we do Botox as well, and we're doing a special for that. So this month is Fibroid Awareness Month. So that's what we're going to talk about today. But it's also UV Safety Awareness Month, which is why we talk about wearing the sunscreen. And I tell people when you put sunscreen on, it only lasts for so many hours. So I always recommend for people to reapply at least every 4 to 6 hours. Now, I've had people say, well, I get the sunscreen that is 120 proof. Okay. You don't have to go that high, but okay. You still need to reapply in 4 to 6 hours. It is not a 24-hour lasting sunscreen. So make sure you are doing sunscreen, especially for the summer. If you're going away on vacation, some of these places that you're going to, sun's a little closer to you. So you got to make sure that you are protecting your skin. That's probably the easiest thing that you can do and probably the least expensive that you can do to protect your skin. So make sure you are managing your sunscreen to protect you from UV rays. But back to the topic at hand, which is going to be fibroids. And I will tell you that probably over 60 to 70% of women will have fibroids. Do they always bother you? No, they do not. So surgery is not the first thing that your doctor should be talking to you about if they discover that you have fibroids, because the majority of them have them. Have them as well. Doesn't bother me, so I didn't bother it. Now, what can be the symptoms that people have where it is starting to become a concern? One of the biggest complaints that people will have is heavy, prolonged periods. It can also be pain, depending on the size of the fibroids. It can be bladder frequency, especially if your fibroid that is sitting in front, pushing on your bladder. It can be severe constipation because if you have a fibroid that is pushing on your colon, that can slow the movement of stool. So there are multiple symptoms. When you go to have your annual exam, your gynecologist, or if you're seeing a primary care doctor that sees you, they should be examining you to feel to see if your uterus is enlarged, to make sure you don't have any enlarged ovarian cysts. But if you do have fibroids, one of the biggest things, or one of the first things that we'll do is actually get an ultrasound. Because we want to make sure, how many do you have? Where are they located? Are they in the lining of the uterus? And I will tell you that the ones that are in the lining of the uterus usually causes heavier periods. Is it pushing on something other than like where it's supposed to be? So we get an ultrasound so we can actually determine where the fibroids are, how large the fibroids are, and whether or not we need to do anything. And once again, the reasons that people will have treatment, and there are a variety of treatment. It is not just surgery. And once again, probably shouldn't be the first thing that your gynecologist or whoever sees you tells you you need to have. There are other options, which we're going to get into. But one of the things I tell people, if you're having heavy or irregular bleeding, you will need to have a biopsy. And most of them are done in the office. Ideally, it is done where your doctor is actually looking inside the uterus as they do the biopsy to make sure, do you have a polyp? Is there something else that they actually see that can be treated at the time of the biopsy? So that's number two. So once again, the ultrasound is going to be number one. Number two, you got to have a biopsy if you're having heavy, prolonged periods, because we want to make sure that there is nothing else that's going on, such as uterine cancer. Anyone who is menopausal and you start bleeding again, that is not normal. You have to go and see your doctor. I've had people who came in, they were 60 and 70, and they were like, well, I just thought that that was normal. If you have gone through menopause, it is not normal for you to actually have a cycle. I'm going to stop this, sorry. But what I tell people is that anyone who is menopausal, You should not be experiencing any further bleeding. If you are, please make an appointment with your gynecologist. Don't just assume that this is normal. It is not. Make sure you see your gynecologist. So the biopsy is number two. What are the treatment options? It all depends on the size of the uterus, where the fibroids are, what your symptoms are. For people who have heavy bleeding, we can start with medication. There's something called myfembree. That's one of the medications that actually decreases the amount of bleeding. It doesn't change the fibroids, but it helps your symptoms. And that's something that you would take every day. Everyone is not a candidate for it, so you'd have to talk to your gynecologist in regards to it. There's something called Lysetta, or transaminic acid is the generic name. That is a medication that actually also helps to stop bleeding, but you take it 3 times a day during your cycle. We have some people who don't want to take a pill every day, which is fine.
That would be me.
That's fine. Lysetta is an option that you can do, but you have to do it 3 times a day during your cycle. The other options are we can do hormones. So I've had people do anything from an IUD that has a progesterone hormone to taking birth control pills to doing the vaginal ring to doing the depot injection. So there's a variety of birth control options that we are using to treat your symptoms of bleeding, not necessarily just for birth control. So that's another option that you can do. And I'm gonna go, there's a list. So there's a couple more that are non-surgical. There is something called a uterine artery embolization or a uterine fibroid embolization that is done by radiology. And what they do is they go to the groin and they inject a substance into the blood vessels that supplies the uterus. That generally stops the blood flow to the fibroids, which the majority of the time will cause the fibroids to shrink. They don't completely go away, but they will shrink. And for most people, especially if you have a larger uterus, it will shrink it enough that it's not uncomfortable. It may stop if you've got urinary frequency because you have a large fibroid. That may help to shrink it so you don't have those symptoms, but it also helps to stop the heavy bleeding. Does it work 100% of the time? No, but it works. It's probably a high percentage, maybe around 70, 80% for most people. And that process can take anywhere from 3 months, usually about 6 to 9, just so you know. And you do have to do follow-ups with that. So that's the uterine artery embolization. Now, if you don't have large fibroids that are in the lining of the uterus, there's something called an endometrial. I know I'm using all these words, but it's called endometrial ablation. And all that does is it burns the lining or destroys the lining of the uterus. So when it is time for your cycle, there's nothing there to shed because it has already destroyed that lining. Now, your body is smart. Over years, there is a possibility of your lining trying to heal itself and to return. So I would say that 8 out of 10 people who have a uterine ablation, an endometrial ablation, they will either have no cycle at all or the cycle will be extremely light. And that's all that they're looking for. They're looking to treat those symptoms. Is it going to shrink the fibroids? No, it is going to help your symptoms. There's another, it's been out for a little while. It's called Acessa, which is laparoscopically. So we make little incisions and they use an ultrasound that has a probe. And the probe goes into the fibroid and causes it to shrink. So with that procedure, you have to do the individual fibroids to cause them to shrink. So that is one that will also shrink the fibroids. Now we're going to get into more surgical options. If you have fibroids and they are large or they're causing a problem for you, there is something called a myomectomy. What a myomectomy is it is strictly removing the fibroids. It is a surgical procedure to remove the fibroids. Can fibroids return? Yes. There's a possibility that those fibroids can return because you may have some very small fibroids that they may not feel or see, and over periods of time, those fibroids can grow. So that is called a myomectomy. We usually kind of reserve that to someone who just really wants to keep their uterus forever, which is fine, or people who want to conceive at a later time. Because we don't want to do anything that's going to be harmful to cause you not to be able to conceive. So if you want to get pregnant, it is not ideal for you to do a uterine fibroid embolization or an ablation because we don't want to destroy or limit any blood supply or cause any damage to the tissue if you want to continue to or have a possibility of having children in the future. So that is the myomectomy. The next one is a hysterectomy. Now, hysterectomies have evolved and they have gotten better and better and better. So now the majority of gynecologists, when they talk about hysterectomies, they talk about doing it laparoscopically, which once again, it's small incisions. They either detach everything from above and pull it out through the vagina and then stitch everything up. I know this might be a little graphic for some people, but that's what it does. The plus with that is that the recovery time is significantly decreased. So a lot of people will go home that same day after having surgery or either the next day, and their recovery time may be 1 to 2 weeks. Before, we would make larger incisions and you would stay in the hospital between 2 to 3 days and your recovery time was 6 weeks. So once again, and there are still some people who will need to have an open surgery where they make an incision. If your uterus is up to your chest, they cannot do this laparoscopy. So, if your uterus is growing like that, you need to be seen before it gets to that point, ideally. But I tell people that the other option is the OA. And even that's still a little bit better than what it was, but we make an incision and actually remove it that way. There's also, if the uterus is small enough, that you could do everything from the vagina and detach everything from below and then close the vagina. And you go home the same day. Recovery time is still the same. So there's a lot of different options and a lot of different ways. But I want people to just make sure that any bleeding that is lasting 10, 12 days, that you are soaking diapers, that is not normal at whatever age that is. And you need to actually see a gynecologist to be evaluated. So, there's your fibroid month.
I have a question for
Yes.
you about fibroids. So I had to have a hysterectomy. I
Okay.
had 23 fibroids.
Okay.
And they just take those out, right? And as I've learned as a nutritionist, there are some things that you can do eating wise.
Yes.
They don't take the fibroids away, but you don't want to feed them either.
Right.
What are your thoughts on that?
So I always tell people, and because we're big on dietary changes anyway. So sugar, carbs, it will cause your bleeding to be heavier, and it will probably cause you to have more pain. And they have shown that it may stimulate the fibroids to grow. So I do tell people, I have had a couple people who have done the raw diet, where all their food is uncooked, and they have been successful with decreasing the fibroids. So I do tell people, even if you just have menstrual cramps, they're pretty severe. I tell people to reduce the sugar and the carbs.
An anti-inflammatory diet is best if you have fibroids, and working alongside your gynecologist, of course. But ladies, the sweet treats is not making it better.
It makes it worse. And I don't think people are aware that sugar is inflammatory. People don't realize it. So even my patients who have endometriosis, I always tell them, you have to really cut the carbs and the sugar. That's going to be our theme for the rest of this year. We're going to cut the carbs and the sugar. So yes, nutrition definitely plays a role with fibroids. And even doing so, tranexamic acid or Lyseta is in the family of anti-inflammatory medications, which is why it works. And so that also, like I said, helps to decrease the heaviness. But if you're not sure what's going on, you need to actually see your gynecologist just to make sure that it's not something that you need to address immediately, such as cancer. Because most of the time it's just related to fibroids, and 99% of fibroids are benign. There is a 1% chance that they are not. So we really encourage just to make sure if you're unsure and you're bleeding heavy, you're bleeding irregularly, like you shouldn't have a period every 2 weeks. That's not normal. You shouldn't go through a pad every hour. That's not normal. Those are things that you have to go and see your gynecologist. It may not be a fibroid, it can be other things, but you need to have it addressed. Any questions out there?
A couple.
Okay.
Can fibroids affect fertility or pregnancy?
Yes. So that is one of the things that I tell people, and it depends on, once again, where the fibroid is located and how large the fibroid is. What I tell people who have large fibroids, your risk for having a preterm delivery or miscarriage are significantly higher, depending on, like I said, the size and where they are located. So you definitely need to have an ultrasound performed. There are some fibroids that won't affect it. So we kind of go, there's a rule of thumb with fibroids in pregnancy, is that 1/3 of them will not change, 1/3 of them will get smaller, and 1/3 of them will grow. And we don't know which third group you're going to be in. So those are things that we have to monitor, especially if they're really large fibroids. And also in pregnancy, if you do get pregnant, sometimes because the baby needs the blood supply. And so we want all that blood supply to go to the baby, which means that less of it is going to the fibroid. And when that starts to happen, the fibroids can sometimes become necrotic because it's not getting that blood supply. So people can have severe pain. So it's just things that ideally you should know before you conceive, but if you don't, they have to watch you and they have to monitor you during the pregnancy to see what the fibroid is the baby growing like it should? So those are things that we have to watch. So yes, it can affect fertility and pregnancy.
Okay. A couple more. Can they actually cause cancer? Can fibroids cause cancer?
Generally, fibroids are 99% of the time benign. But we when someone's having heavy bleeding and irregular bleeding, we want to make sure that it's not cancer. So we do a biopsy. However, there is a 1% chance that the fibroid and that is cancerous is in the muscle. So the only way we could diagnose that, we get an MRI and we actually do a hysterectomy.
And one more. What causes fibroids?
So there are a lot of speculations. We do not know 100%. We have seen that when people go through menopause, the fibroids shrink. So we don't know if it's hormonally associated. That is one of the thoughts. Sometimes they can be genetic because we see it a little bit more within certain families. So there are multiple thoughts of why fibroids occur, but it is very common. So if someone tells you that you have fibroids, you're okay. It'll be okay. If you're not having any symptoms at all, we don't have to do anything. but we do keep an eye on it just to make sure it's not growing, it's not moving into a different area, pushing on the bladder, pushing on the rectum. And once again, most of the time when we're treating fibroids, it's really because you're having certain symptoms. So hopefully that was helpful. And this is Fibroid Awareness Month. So now you are a little bit more aware about fibroids, and you are not alone because once again, at some point in most women's lives, you will be told that you might have small fibroids, and it's not uncommon. It's nothing that you have to do about it unless it is causing you a problem.
I agree.
Yeah.
Mhm.
Okay. So, because it's the summertime, I need a little break. So we won't have our Talk with Terry Tuesday in August or September, but I'll be back in the fall. But you can always come and see me at the spa. But once again, we are glad to have MJ join us.
Thank you so much for having
We
me.
are going to all grow, let me see, wiser.
That's right.
We're all going to grow wiser, gracefully, healthier. I always tell people 50, 60, 70 is not what 50, 60, 70
Yeah, sure,
used to
not.
be.
Mhm.
So we need to lift those weights,
That's right.
watch our diet, stretch, all the things that MJ and Radha are going to talk to you about. So come see us. Yes.
Visit my website for more information.
Give them your information again.
My website is harvestlivingwellness.com. I'm Coach MJ. You can find all of my information on there. Again, our first group class is going to be on August 1st at 8:30 a.m. There are 15 slots, so make sure that you get on the mailing list, the email list, to secure your spot and become a member of Harvest Living Wellness Group Fitness. And we'll be rolling out Wednesday night classes as well, so stay tuned.
Oh, good. And we'll have all of her information as well. So you can also contact the spa. So the number here, 708-864-4988. And for those of you who don't know where we are, we're located at 7151 183rd Street in Tinley Park. And for those who came out, we had a Pilates and mimosa class.
Oh,
That was
how
our
was
first one.
it?
It was so much fun. So shout out to Brittany. She did a really good job. We have quite a few clients that came. Everyone really thoroughly enjoyed the
Oh,
class. And
fantastic.
so it was a good stretch. It made me realize that I can't have a six pack.
Yes.
For the rest of
Do it. It's
So,
possible.
it is possible. So thank you guys for joining us. We'll see you back in October. Give us a call or stop by. Be healthy, be blessed, and we'll see you soon.
And Geneva Reed, photographer, Cart, said, thank you, Dr. Scott.
Thank you guys. We'll see you soon. Bye.